First off, we need health care reform in Washington. It should absolutely include the public option. That's the only way we're going to really bring down cost and truly cover everybody. I think if they pass health care without public option, it's going to be a problem. I think long term, I believe that we've got to experiment with and consider and look at the Medicare model of providing health care. Single payer is your phrase. I think the public is scared of it right now, but they love Medicare. And I think the politicians have done a poor job of describing the benefits of a Medicare for all system. I'd like to see federal changes in pension law and some other things, and my old friend Dennis Kucinich is hard at work trying to do that, to make it easier for states to experiment with a Medicare model. I think that's the only way we're going to eliminate the unnecessary costs from duplication and paperwork excesses and the fact that the average doctor's office has more clerical help than nursing help because they got to deal with all the different insurances. And frankly, the insurance companies are making too much money and denying too much care the way it is now. So, however, your question about the bill, the reason I'm not willing to endorse that bill at this point is I'm not sure they got the financing right. That bill calls for about doubling the personal income tax and a 10% payroll tax on businesses. That would end up in us spending less money than we currently spend. There's no question a single-payer approach is more efficient and less costly, and that's good. However, I'm not sure, I mean, most businesses, I think, pay about 20% in payroll toward their health care. I'm not sure we should reduce it to 10 and let them off the hook, because the excess has to be made up by the individual taxpayer. And I can tell you that the big companies will say, wait a minute, we're interested in single payer, but we want to pay nothing because we have to compete with Western European companies that pay nothing for their health care. So I'm not sure where we're going with the financing. And the bill's a great idea. There's some members that have co-sponsored it. It deserves a hearing. But I'm not sure they got the financing right.